Cefotetan is an antibiotic medication used for the prophylaxis and treatment of various bacterial infections, including urinary tract infections, bone and joint infection, and lower respiratory tract infections. In this video, let's find found. What is cefotetan? What is cefotetan used for? Contraindication. What are the side effects of taking cefotetan? How does cefotetan work? How to use cefotetan? What is cefotetan? Cefotetan is an injectable antibiotic of the cephamycin type for prophylaxis and treatment of bacterial infections. It is often grouped together with second-generation cephalosporins and has a similar antibacterial spectrum, but with additional anti-anaerobe coverage. Cefotetan was developed by Yamanouchi. It is marketed outside Japan by AstraZeneca with the brand names Apatef and Cefotetan. What is cefotetan used for? For prophylaxis and treatment of bacterial infections. Contraindication. Cefotetan is contraindicated in patients with a known allergy to the cephalosporin group of antibiotics and in those individuals who have experienced a cephalosporin-associated hemolytic anemia. Side effects. The chemical structure of cefotetan, like that of several other cephalosporins, contains an N-methylthiotetrazole, NMTT or 1-MTT, side chain. As the antibiotic is broken down in the body, it releases free NMTT, which can cause hypoprothrombinemia due to inhibition of the enzyme vitamin K epoxide reductase, and a reaction with ethanol similar to that produced by disulfiram, antabuse, due to inhibition of aldehyde dehydrogenase. Pharmacodynamic. Cefotetan is a semisynthetic cephamycin antibiotic that is administered intravenously or intramuscularly. The drug is highly resistant to a broad spectrum of beta-lactamases and is active against a wide range of both aerobic and anaerobic gram-positive and gram-negative microorganisms. Mechanism of action. The bactericidal action of cefotetan results from inhibition of cell wall synthesis by binding and inhibiting the bacterial penicillin binding proteins, which help in the cell wall biosynthesis. Half-life. In volunteers with reduced renal function, the plasma half-life of cefotetan is prolonged. Dose. The dose of this medicine will be different for different patients. Skin and skin structure, mild to moderate. 2G4Q, 24HR. Skin and skin structure, severe. 2G4Q, 12HR. Urinary tract. 500 mg 4/IMQ 12HR, 1 to 2G 4/IMQ 24HR, 1 to 2G 4/IMQ 12HR. Other infection sites. 1 to 2G 4/IMQ 12HR. Severe infection. 2G 4Q 12H. Life-threatening infection. 3G 4Q 12HR. Surgery infection prophylaxis. Colorectal, non-perforated appendectomy, hysterectomy, 1 to 2G4. Ruptured viscus, 1 to 2G4Q12HR. Safety advice. Cefotetan has been assigned to pregnancy category B by the FDA. Animal studies have failed to reveal evidence of fetal harm. There are no controlled data in human pregnancy. Cefotetan should only be given during pregnancy when need has been clearly established. That's all the information about cefotetan we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.